thank you very much for your question. You're asking how about depression due to environmental factors, e.g., loss of loved ones, abusive relationships, and of course, if you're bewitched. So before I go on to answer your question, I'd like to make an acknowledgement about the boundaries of psychiatry because I can't answer your whole question. The aspect on bewitched, the last part, is beyond what psychiatry can explain. And so I'm going to answer the other part, except the part of if you're bewitched. To answer the first part, it reminds me of an older method of categorizing depression that we no longer use. So before, they used to categorize depression in two main categories. Depression can be endogenous or exogenous. Exogenous means that there are external factors in the individual surrounding that have precipitated the depressive episode. And some of the factors are the ones that you've listed in your question, like loss of a loved one, being in an abusive relationship, losing your financial status, social status, things like that could precipitate a depressive episode. And then there was a different category called endogenous depression that was different from exogenous, where there were internal factors, biological factors, something with your receptors, something with the neurotransmitters, something with the neurons structurally that was precipitating your depressive episode. We no longer use that category. Now we have in the diagnostic manual that we use to diagnose depression, the DSM, we have major depressive disorder, and the most common model that we use to approach assessment of depression or mental illnesses generally is what we call the biopsychosocial model. Biopsychosocial has got three main parts: biological factors, psychological factors, and social factors. And we assess all three of them to understand which one led to the onset of the depressive episode. So it's very important to do that because a person might be going through an adversity, but it's not the one that actually precipitated the depressive episode. It might be the one that exacerbated it. It might be the one that made it worse, but it's not the one that caused it. And so, for example, in your question, loss of a loved one, when a person comes to you, especially around that time, it will be very easy for you to make an assumption that the loss of a loved one is what has impacted the person psychologically to the point that it's overwhelmed their ability to cope, and now it's precipitated the depression. But if you ask the person and you probe further, you might realize that the person was depressed before the loss of the loved one. And so that means that the approach of managing the depression in this person would be expanded. It won't just focus on the grief that the person is going through. And this is very important. So the biopsychosocial model then combines both the external factors and the internal factors, both exogenous and endogenous, that we used to use in the past, to understand which factors exactly precipitated the depression, or which ones are making it worse, which factors are making it worse, meaning the person already got depressed, and then because they were isolating socially, because they were not going out and getting the sun, because they were not eating well, so these factors become exacerbating factors, perpetuating factors, but not the factors that actually put the person in the depressive episode. These are very important distinctions to make for a clinician to be able to intervene or tailor make a treatment that is going to be effective for the patient.